Good morning. So shifting narratives. So I go onto Facebook and the Outrage algorithm is at work, and it shows me that two of my relatives have posted something about COVID hospitalizations, and so it's like the numbers look scary. It's a graph, a chart, all this, and they got me. I'm agitated. I'm thinking about it. I researched it, all this. I'm tempted to fire right back with, "Oh, here's why you're wrong," that kind of thing. One of the things I try to remember when looking at news or anything like that is there's this old saying: if it bleeds, it leads. In other words, the news media, papers, whatever, they're a business, and they push stuff that sells, and violence, carnage, blood, pictures of hospitalized with tubes, anything scary and gnarly, it sells, so they push it. So that's one saying I try to think of. The other one is this idea that if news anchors told the truth, here's what the nightly news would look like. They'd sit down and say, "Hello, America. Here are the lies your government would like you to believe today." And so I love that saying because it just puts in the perspective for me and the idea that what's really going on here, or at least just what to be aware of, that there's an agenda, or at the very least there's a business model of selling news, and in order to sell news it's got to have a hook, of good marketing. And so the shifting narrative that I've seen lately is the hospitalizations. So if we take a look, I Googled it, and it's like, oh my gosh, this is like, gnarly pictures of hospital beds and people with tubes, and scary, and they're like, oh, I should have got the vaccine, or I should have, whatever, it's scary, super scary, like hard. I was like, oh my gosh, if this was the only thing I saw every day, I'd be in a terror. I'd be in panic, that's why I don't watch that stuff, because I know how it affects me. And, it reminds me of the Mark Twain quote: if I don't watch or read the news, I'm uninformed. If I do watch and read the news, I'm misinformed. And so kind of this catch-22 of wanting to know what's going on, but knowing that if I tune into the dominant narrative, I'm going to be misinformed. There's an agenda. And so here it is. So let's look. Concerning rise in COVID-19 hospitalizations. And then, the sub-headline: patients filling more ICU beds, and so that's a scary headline. Then if we scroll down a little bit, it's 19 investigates. This is a local news outlet. But local hospitals told us right now they have enough ICU space. Well, why isn't that the headline? Why is it straight to fear? Because it bleeds, it leads. Fear-mongering sells. It's good business. Then we go down furthermore. Overall, in Ohio, about 75% of beds are full. Now, I'll show in a minute, but the national average is 70, 75. And historically, in order for an ICU to be efficient and make money, and for the hospital not to go bankrupt, they want somewhere in that 70, 80%, because that's just good business. And just thinking of it in terms of skills and being sharp and practice, you got to have work. If the people in the ICU are just sitting around doing nothing all the time, and all of a sudden something happens, they're going to be out of practice. They're not going to be tuned up. They're not going to have their skills sharp. That's my own experience. I'm a surfer. When the surf season starts, I go out and I'm out of shape and I'm not as good. But then by the end of the season, I've been surfing every day for multiple hours. My skills are sharp and I'm in tune. And then even we go even further down, and it's 79% is the national average. So Ohio is below the national average, and still the headline is fear-mongering and talking about, it's super frustrating. I'm going further down. Low capacity is not an issue at this time. So why do you leave? Lies. I wanted to know, what's the average? Is it just some one-off that something's happening? Is there something big trend changing, new variant, this kind of thing? And so I look at the averages across the year from September through September, and we see this graph. It's pretty consistent, the beds that are being occupied by non-COVID, the COVID, there's peaks and valleys, and then the available beds. But throughout the entire thing, this gray area at the top, it's available space. Space is available. It's fear-mongering, plain and simple. It's selling a new narrative that's fresh, that's hard to dispute because it's fresh. All of a sudden it pops out of nowhere, and I don't know the history. Without looking into it, it sounds scary. It's hard to refute something that seems to come out of the blue, and I have no previous experience with it. So it takes a lot of digging and discernment and critical thinking and calmness on my end to be what is going on here? And on face value, it's really hard to not be overrun with fear and panic because the headline is so scary. And then here, HHS, they have national things, inpatient by bed, all hospital beds, and there's 780,000 beds in the US. 580,000 are non-COVID, 70,000 are COVID. So that means like 90% of the people in there are in there for something other than COVID. Why are we shutting down the entire world and focusing all resources on something that's 10%? Why aren't we focusing all those resources on the 90%? It's insane. You know, if you really want to help people, if you want health, if you want to save a lot of lives, put the focus on the thing that's the big deal. You know, don't focus on the tiny percent. When I go surfing, I don't ask, oh, where's the spot I can go that's going to give me a 9% chance of having a good session, of getting good waves? No, I don't ask that question. I say, where's the big bet? Where's the payoff? You know, where's the 90% chance of a good session? That's what I want. And then further down, the HHS has the ICU for COVID. Only 20% are COVID. The bulk is something else. And again, look at the available space on average. 23%. And there's these other stories about hospital staffs firing people, that, you know, the new vaccine mandates, there's a percentage of people who are leaving or who are being forced out. And so that ties into the key metric of this ICU and hospital thing is it says number of staffed. If staff is being let go or forced out, like, it makes sense that the number of staffed beds available would go down. These two things happening simultaneously is insane. You know, if there's a rise of something, if there's a need for more staff, why would you get rid of staff at the same time? That's crazy. And here from Reuters, you know, New York hospitals fire, suspend staff who refuse COVID vaccine. So if we scroll down to the bottom, it says there's 5,000 at this one hospital thing, New York City's 11 public hospitals. How are you going to replace 5,000 staff? And they're saying they're going to call in the National Guard and train them to be, you know, like, what kind of sense does that make? And how are you going to, like, you're just going to bring in a bunch of soldiers and they're going to just be like instant nurses, instant medical professionals? How does that work? Maybe the more insane number is it says in the state, there's a total of 450,000 hospital staff in New York, and 16% are not vaccinated or not fully vaccinated. So what's 16% of 450,000? Well, roughly that's 30, 60, 70,000 people that are in danger of being fired or let go. I mean, if there's a real pandemic and there's a shortage of beds, we're going to fire 70,000 workers in that field. What kind of sense does that make? Or, you know, if you're trying to create a pandemic or make the problem worse, that seems like a good way to do it. And then a judge that says the appeals court overruled the decision that they could, you know, not be mandatory vaccinated. So, you know, just everything points to something crazy going on here, that it's almost like they're trying to manufacture this thing. It's sad, you know. An Atlantic story. Our most reliable pandemic number is losing its meaning. Here's the meat of it. It says 40 to 45% of people in the VA hospitals who tested positive for COVID, they were in there for psychiatric reasons, meaning they didn't have symptoms of COVID. They were in the hospital because they were having psychiatric problems, and because they were forced to get a COVID test, they get labeled COVID, even though they came in there for psychiatric reasons. Then further down, it says mild or asymptomatic was 36% last year. And then in this year, that number has come up. 48% are asymptomatic. These are people who are, you know, labeled COVID. They're mandatory testing at some of these places, and half of the so-called hospitalizations are not COVID hospitalizations. You know, so there's funny math going on here, and it doesn't get reported that way. The big headline isn't, oh, this, you know, half of this is BS. No, it's all fear and scare. Even with vaccinated hospital patients, 57% have mild or asymptomatic. So any talk about, you know, all these people in the hospitals, there's a big asterisk saying at least half of those are BS. They're not in there for COVID, they're there for something else. How full are hospital ICUs near you? And here, the New York Times, it's got this map. And then over here, national average, 68%. These are hospitals, we can flip it either way. If we flip it this way, oh, it looks real scary. You know, 250, let's zoom in. So if we look at the thing, it's like, oh my gosh, Alabama, you know, they're 250%, they're way over capacity, 100 plus, 100, oh my gosh, it's terrible. But then we flip it around, it's like there's all these other places that only have 6, 7, 8% occupancy, 6, 8, 8%, 15, you know, there's tons of hospitals that are 80, 90% open and available. They have 80 to 90% of their beds free, so it's real easy to lie with statistics and push this narrative on people who aren't prepared for it. I wasn't prepared for it because I'm not out there looking for narratives. I don't know what the next BS number they're going to start pushing, and this is why they do it. They spring it on us like, hospitals, hospital beds, and then nobody has looked into it. They don't have numbers on it, so they're not prepared to refute it because they don't know. It takes a while to dig into this stuff and be like, wait a minute, come on. You're just pushing stuff here. Look at all these hospitals. They're only 30%, less than half or more than half of the beds are open and available for all these places, It's easy to like dig a little in and find out that it's not the case. And even here where I am in the SF Bay Area, it says, are hospital numbers inflated? Of course they are. Then we look into it. It's like half the people in there aren't there for COVID, or they don't have any symptoms. It's just a numbers game of taking this test. There's the quote like, a virus so dangerous you have to like get a test to know you even have it. It's just the same stuff. Just trying to disguise it. Keeps pushing the narrative with new BS because the old BS isn't working anymore. And here's more statistics of like Florida, and we see, it goes up and then it comes back down. It goes up and then it comes back down. Then here, this is from Hospital Medical Director. This is written 2017, so we know it's not COVID biased. It's just talking about what's the ideal occupancy if you're really trying to run a business and how to like do it efficiently. And they throw out like 85% is like the gut feeling of what works, but then it's more like, well, that doesn't leave enough buffer here and there. And the conclusion is like, 85% full would be good for like Monday through Wednesday when there's less people coming to the hospital, stuff's not happening. And then to have that change later in the week to lower it to 80%, Thursday and Friday, there's an uptick of people going in. And then for the weekend, 75% people are starting to leave the hospital, towards the end of the weekend. MSN, look at the picture, it's scary. All these tubes, like my mom worked in hospital and nursing care for decades, and every time I went in to see her, I was like, oh, get me out of here. This place is like crazy, gnarly, like it's just not a place of health. Here's the headline: nearly half of all hospitalized patients with COVID-19 had mild or asymptomatic. That means that they didn't even know they had it, or it's nothing, or they're just like big deal, and not something to like panic and go into a tizzy and try to like shut down the whole world or rearrange the whole world over something that people don't even know or don't even really feel. It's crazy. And when I was doing all this research and thinking about how I was going to respond to my relatives, Facebook posts that I thought was BS or didn't buy it, or, I realized I'm doing the same thing they are. I'm looking to validate my beliefs, to know that my choice is valid and safe and smart, and basically that I'm taking care of myself. I did the right thing. I'm going to be okay. Basically, wanting to be okay and wanting to protect those around me. I'm concerned about my son and my family, and they're doing the same thing. We're just coming from different sides of the coin, but we underneath whatever statistics or hospital thing. So I basically realized instead of giving into the Facebook outrage algorithm and firing back with some heated thing, I was like, oh wait. I want to be validated and seen, and I want to be heard, and I want to share with people around me how, this is important to me, to all of us. This is like, it matters. People, if we're talking life and death, that's a scary thing. We all want to feel safe and that we're protected and those around us are going to be okay. So common ground. I found the common ground. And if I was going to reply, I'd be like, oh man, I hear you. Like, yeah, I want to validate my stuff too. If I don't get vaxxed, I want to know that I'm okay. And if I did get it, I want to know that it works and it's effective. Looking for confirmation and just wanting to feel safe. And so that's where we can come together and be like, oh, hey, I want to feel safe too. And I hear you want to feel safe. I got you. Like, let's have each other's backs there. Let support each other and say, yeah, I hear you. I'm listening. I heard this old like Native American idea where we don't listen to, there's no such thing as a debate in that culture. The idea of trying to prove the other person wrong would be seen as crazy talk. The idea is just to understand and hear. And like, I can be right and they can be right. And we don't have to invalidate each other's truth. We're not trying to sell each other on something. It's about listening and understanding and being like, I hear you. and you hear me, I feel heard. Like win-win. We don't have to like battle and war it out. We can come together and give each other a big hug and say, I hear you, you hear me. And that's where the good feeling comes from for me. And so that's my hope, that we have one mouth, two eyes, and two ears. So let's listen twice as much. Let's see each other twice as much before we want to just fire off and talk. So yeah, thanks for watching.